The top stories tonight in Y News. The Philippines logs another all-time high with nearly 10,000 new COVID-19 cases today.
The Department of Trade and Industry rejects possible extension of the general community quarantine bubble.
The IATF allows once-a-day religious gatherings with 10% capacity in churches inside the NCR plus bubble. The Department of Health reiterates that only health workers are allowed to be included in the quick substitution list for vaccination.
U.S. President Joe Biden vows to push China to play by international rules at his first solo news conference since taking office.
And patients in a hospital in Papua New Guinea receive free meals from the MCGI Global Feeding Program. Good evening, Philippines and the world. Today is Friday, March 26, 2021. I am Maureen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The country continued to break its daily record for new coronavirus disease cases, with the Department of Health reported 9,838 additional infections today. The new cases broke the yesterday's record of 8,773. The new infections brought the number of active cases in the country to 109,018. The Philippines already has a total of 702,856 confirmed COVID-19 cases. Of the active cases, 95.1% have mild symptoms, 3% are asymptomatic, 0.7% are in critical condition, 0.8% have severe symptoms, and 0.42% are in moderate condition. The DOH said that the daily data from 7 testing laboratories were not yet included in the latest counts since they were not able to submit their data on time. In the latest case bulletin, it was also shown that 663 new recoveries were recorded, raising the total of survivors to 580,689. The recovery count represents 82.6% of the total number of people who tested positive for COVID-19. The death count also jumped to 13,149 after 54 more patients died. The Department of Trade and Industry has rejected the possibility of extending the general community quarantine bubble in the National Capital Region amid the continuing surge of COVID-19 cases. Joe Anano tells us why.
As the country's economic managers are pushing for the revival of our economy, the Department of Trade and Industry says that they are not in favor of extending the implementation of the general community quarantine bubble placed over Metro Manila and 4 nearby provinces, which will lapse on April 4.
Kung tatanungin mo ang DTI, gusto na sana natin yung SEC na maipa-open na ulit sa April 5. Hindi naman siguro natin kailangan totally isara yung mga negosyo or yung paggalaw ng tao dahil kung susundin lang natin lahat ng mandatory health protocols, makakatulong pa rin yan pagtuloy-tuloy ng negosyo at the same time ma-maintain natin yung health.
The idea emerges from the previous statement of the Octa Research Group, wherein the expert says that the possible impact of the GCQ bubble in slowing down the reproduction number of COVID-19 cases may be seen in the next 4 weeks. As the interagency again limits several business operations, while some were ordered to temporarily shut down to mitigate the rising cases of COVID-19. DTI says that the country's economy can still manage as of this time, as this only affect very small percentage of business industry.
Kaya pa naman rin natin dahil konti lang naman yung sectors na sinara natin ngayon. Ito yung mga medyo mga people-intensive, yung talagang hindi maiiwasan na magdikit-dikit sila. But all other industries and sectors are still working, especially ang manufacturing natin, logistics, export. Lahat po yan, except konting services sector lang naman ang nabawas. Tuloy-tuloy pa rin naman ang pag-andar ng ekonomiya natin.
The National Economic Development Authority earlier pointed out that the surge in COVID cases is not because of the reopening of economy.
When we opened the economy last October 12, 2020, cases did not spike, nor did cases spike during the year-end holiday and the first 2 months of 2021. Yung cases nga, it was on a generally downward trend. This was due to our strict compliance with the health standards and our gradual and careful approach to the reopening of the economy.
Based on NEDA's cost-benefit analysis, it shows that there are 3.2 million Filipinos that are suffering from hunger, more than 500,000 unemployed, while there are almost 79,000 non-COVID deaths, as many Filipinos have lost their income because of the pandemic. And this remains as a huge challenge to the government to balance the economy with the ongoing health crisis. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Interagency Task Force Against COVID-19 has allowed the conduct of once-a-day religious gatherings in the National Capital Region and 4 neighboring provinces from April 1 to 4. Rosa Nicos will tell us why.
Pinayagan po ng inyong IATF ang once-a-day religious gatherings mula 1 hanggang 4 ng Abril.
The government's pandemic task force once again revised its guidelines and allowed once-a-day religious gatherings in areas covered by the NCR Plus bubble from April 1 to 4. However, additional restrictions will be observed aside from the minimum health standards, such as gatherings will only be at 10% of the church or venue capacity. And to ensure this, reservations should be done to prevent people from flocking outside the venue. Gatherings and conduct of religious activities outside the church or venue are also not allowed.
Upang maiwasan ang pagtitipon-tipon ng mga tao sa labas ng simbahan, ipinagbabawal ang paggamit ng audio-video system sa labas ng simbahan o venue habang mayroong misa o worship service.
However, the public is encouraged to attend religious activities through the internet or online platforms. IATF directs the local barangay units and Philippine National Police to enforce the protocols. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of the Interior and Local Government lauded the decision of the Interagency Task Force on the Management of Emerging Infectious Diseases to allow the limited religious gatherings in areas under the GCQ bubble. The Philippine National Police, meanwhile, will heighten its alert status over the weekend. Lea Ilagan will tell us why.
The Department of Interior and Local Government, or DILG, says the decision of the IATF shows that the government fully respects the right to worship and recognizes its importance in providing spiritual support in these trying times. The DILG orders the PNP and barangays to facilitate the implementation of IATF-approved protocols in the National Capital Region Plus bubble. The Philippine National Police will heighten its alert status as anniversary of the CPP-NPA nears.
Inclined ang mga regional director mag-full alert this coming Sunday. Depende po ma'am kung ano yung situation na doon sa area vis-a-vis yung ating preparation as regards to the anniversary of the NPA. And then as regards to the Semana Santa, heightened alert most likely yan. Until such time that we have to really deploy our personnel that requires full alert dun sa, especially dun sa mga concerned units involved po.
The PNP will also deploy its personnel to places of worship.
We have enough number of police personnel that can be deployed to manage the movement of our people, whether doon sa mga naglalakad lamang o kaya may mga dala-dalang sasakyan. Basta makomply lang yung minimum health protocol, sa palagay ko hindi naman magkakaproblema.
Osana said it is with the discretion of the regional directors if they will place their areas to full alert status based on their security assessment. As to NCRPO Director, Police Major General Vicente Danao Jr., he said they will place the whole NCRPO to full alert status before March 29.
Naka-full alert kami para sa Semana Santa. Hindi lang yon, kundi sa 29 kasi it's the anniversary of the New People's Army.
The Philippine National Police appeals to the public to observe the minimum health protocols to avoid transmission of COVID-19. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Manila Mayor Isko Moreno has signed an order authorizing barangay captains to declare lockdowns in their respective areas. However, some village chiefs are worried on where to get their budget for the strict quarantine. Dante Amento tells us why.
The daily recorded COVID-19 cases in Manila City are continuously rising. Yesterday, the city had 510 new cases, but today it went up to 616, which is very high as compared to the average of 40 to 60 cases per day in the past few months. Thus, through an Executive Number 12, Mayor Isko Moreno Dumagoso has now authorized barangay captains to declare lockdowns given that the number of COVID-19 active cases in their area are 10 or more. The order states that within 3 hours from its issuance, the order placing the barangay or portion thereof under critical zone containment shall be forwarded to the city mayor for his confirmation. A prior notice of 2 days should also be given by the punong barangay for his constituents. The Manila Health Department shall likewise verify the existence of COVID-19 active cases before the barangay could start its lockdown. Meanwhile, some village chiefs says they are willing to follow the new order, but the problem will be the budget.
Okay naman, wala namang problema kung may mag-lockdown. Ang atin lang po, meron lang tayong suporta sa mga tao. Sa pagkain po, yun ang ano naman natin, pangunahin yung pagkain ng mga tao na ilalockdown natin.
Yung nga po ang problema ko doon, yung budget din, siyempre kakapusin kami. Dahil maliit lang naman itong aking barangay at maliit din po ang aking budget dito. Hindi kagaya ng ibang barangay, malalaki, na susuporta nila yung ano mga pangangailangan po sa barangay.
The city, on the other hand, assures the food provision during the duration of lockdown to be distributed per family. The Manila Health Department will then conduct disease surveillance, massive contact tracing, and testing on barangays under lockdown. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Marikina City government is now implementing a new isolation strategy to stop the transmission of COVID-19 on the household level. Janice Inhente reports.
The Marikina City has seen an increase in the number of COVID-19 infections among family members. As a result, the transmission of COVID-19 in the city spreaded fast and quarantine facilities cannot cope up with the increased number of patients. That is why the local government has approved to implement reverse isolation to the families with COVID-19 infections. Under the strategy, if more members of a household was infected by the virus, they will be quarantined at the home, while the negative members of the family will be brought to the facilities prepared by the LGU.
Hindi sila parang evacuees na magkakasama. Hindi. Binibigyan lang natin sila ng pansamantalang area na matitigilan. Dahil negative naman sila eh. Kaya kung nagtatrabaho sila, makakapagtrabaho pa rin sila. Parang binibigyan lang natin sila ng lugar lang na matutulugan, kung saan pwede nilang asikasuhin ang sarili nila, kung saan sila pwedeng kumain.
130 families in Marikina City are now currently under reverse isolation. The local government assures it will provide assistance for families under home quarantine until they are tested negative. Marikina City has more than 1,400 active cases of COVID-19. Jenny Sinhente, UNTV, News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screens and ring the bell for notifications. You may also follow us on Facebook.
The Parañaque City government has started its vaccination for senior citizens. Mayor Edwin Olivares explains that they follow the priority list in the vaccination rollout. Asher Cadapan Jr. tells us why.
The Parañaque City government intends to avoid waste and immediately utilize the remaining doses of AstraZeneca vaccines for COVID-19 that were distributed by the national government. This after the local government unit has already vaccinated more than 90% of the healthcare workers in the city. Mayor Edwin Olivares explains that the remaining 5 to 10% of health workers neither came to their scheduled vaccination or willing to be inoculated with the available supply of vaccine.
Kasi masasayang po yung ating gamot. Kailangan po mabaksin po natin within the day po yan. Lalong-lalo na kapag nabuksan yung vial. Kasi sa isang vial ng AstraZeneca, 10 hanggang 12 na jabs yun eh. So kapag 3 lang ginamit po, yung 7 hanggang 9, masasayang yun. Kailangan magamit natin yun.
The local chief executive also defends the vaccination of actor Mark Anthony Fernandez, explaining he was part of the priority list.
Nagpunta po siya, physically present po siya, at in-screen po siya ng ating pong medical officer. Nakasama po siya dun sa ating priority, dun pong ating may mga comorbidities, yung may comorbid. Yung po yung may hypertension po yung tao, at hindi po uminom pala ng gamot, 1 taon na po siya. So kasama po siya dun po sa ating mga may comorbids na mga priority.
Mayor Olivares, meanwhile, has ordered an investigation of the alleged unauthorized vaccination of a city councilor in Parañaque that he has also yet to identify. Olivares said he is ready to answer the show cause order that may be issued by the Department of the Interior and local government. The local chief executive further said that he followed the guidelines on the national vaccination plan set by the Interagency Task Force against COVID-19 and the Department of Health.
Yes, kasi malinis ang konsensya po namin na sinunod po namin yung protocol, sinunod namin yung ating prioritization, at yung wala po kami binabiolate na any guidelines.
Asher Cadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health stressed that only health workers are allowed to be included in the quick substitution list for vaccination. Meanwhile, health experts say that the recalled doses of unused AstraZeneca vaccine in Bicol is still usable. Aiko Miguel will tell us why.
The Department of Health insists it is clear in the prioritization framework protocol, even before the inoculation started, that healthcare workers are currently the top priority in the country's COVID-19 inoculation efforts. And when they back out on the day of inoculation, the quick substitution list should still include health workers and not senior citizens with comorbidity, government officials, and personalities. Undersecretary Maria Rosario Vergere emphasized that they have given ample time to hospitals and LGUs to prepare their quick substitution lists so they can justify the wastage of vaccines with the inoculation of other sector.
Kung sino yung malalapit sa inyo ng mga private hospitals maybe, o di kaya ay mga private clinics, isama nyo na dyan sa inyong pagbabakuna. But never did we say that we are going to go to the next sector. Dyan po sa QSL protocol natin, nakalagay din dyan that everybody will be informed and instructed when we are going to shift and go to the next sector already. So maliwanag po yan, nasa A sector tayo ngayon, your quick substitution list should include all healthcare workers and frontliners who are directly caring for our COVID-19 patients.
The DOH made the statement after Parañaque City Mayor Edwin Olivares inoculated senior citizens and actor Mark Anthony Fernandez because they were supposedly part of the city's substitution list. According to Undersecretary Vergere, although depression is considered a comorbidity, like the case of actor Mark Anthony Fernandez, still the DOH explains he is not part of the government's current prioritized sector.
hindi pa ho tayo nandoon sa level ng sector na yon para bigyan sila ng bakunang ito. Pangalawa, nagbigay na po ng abiso ang WHO na sana yung AstraZeneca vaccines ay maibigay natin sa healthcare workers para hindi ma-compromise yung ating succeeding supplies na manggagaling sa COVAX.
Meanwhile, the DOH explains that the recalled 7,500 doses of AstraZeneca vaccines from Bicol are still usable. Based on the preliminary report of the WHO and UNICEF, one of the storage boxes containing the 7,500 doses received by CHD Bicol logged a temperature of more than 400 degrees Celsius. However, upon detailed review of the available evidence, WHO and UNICEF found that only the thermometer was faulty. All other equipment and devices used to store and transport the said vaccines were all functional, thereby ensuring that all vaccine doses remain usable.
Ito pong isang box ng bakuna na ito, chinek na natin, may initial information and recommendation na itutuloy ang pagbabakuna dahil potent pa yung mga vaccines. We have a composite team to check it again later this afternoon.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Following reports of some local officials who have jumped the vaccine priority line, a Senate panel is open to investigate such reports of alleged VIP vaccinations. However, some senators say local executives should be considered as frontliners, being in charge of the COVID-19 response in their localities. Arlene Delgado reports.
Some senators are not pleased with the recent reports of local chief executives and non-medical workers who have received COVID-19 vaccines. Senator Sherwin Gatchalian doesn't buy the reason that the local officials did it for their constituents. The senator says it is unfair to the medical frontliners that there are actors and public officials who jumped ahead of the line. He adds this should be investigated and immediately punish those who are guilty. Meanwhile, for Senators Francis Pangilinan and Franklin Drilon, it boils down to the advocacy of vaccine supply in the country. Senate Committee on Health Chairperson Senator Christopher Bongo says his committee is open to investigate the alleged favors being made by some LGUs to accommodate VIPs.
Kamakailan lang nakarating po sa akin na nagkaroon ng pabor-pabor kapag nakarating na ang mga bakuna sa mga LGUs, doon nakakalusot ang mga magpa-VIPs. Hindi po ito katanggap-tanggap. Sino ba ang nagpapalusot nitong mga pabor-pabor na ito?
The senator will form a subcommittee to be headed by Senator Pia Cayetano to allay doubts on his intention for having close ties with the Duterte administration.
Alam ko po na may mga nagdududa sa aking intensyon bilang chairman of the Committee on Health and think that I cannot be fair in conducting investigation, that I am biased towards the administration, that I am here to protect the administration in every way possible. This is simply not true, Mr. President.
However, some senators believe local officials are considered frontliners and should be prioritized. For Senator Francis Tolentino, the IATF should have categorized local executives as frontliners in the first place, noting that they are the ones attending to concerns on the ground and as heads of local health boards. While Senator Coco Pimentel believes the IATF should consider local executives as multi-dimensional frontliners. He adds local chief executives are actually health frontliners who should be given importance, prioritization, and some elbow room to use their imagination in fighting the pandemic. Meanwhile, the Senate is appealing to the national government to allow its purchase of 5,000 Sputnik vaccines for its 2,500 employees.
Kung nagbabakuna na po sila ng mga barangay officials sa Metro Manila, siguro pwede na rin po kami maumpisahan bakunahan ang aming mga tao sa Senado. Maski na mahuli na po mga senador, unahin na muna natin ang ating mga staff. Ang dami-dami sa ating mga staff in every office, Mr. President, ay natatamaan na. I may be bashed in social media, but again, my point is I'm just taking care of our branch of government, which is the legislative branch of government, because I'd like to emphasize, Mr. President, the business of legislation cannot be delayed.
Senate President Vicente Soto III says they are already in agreement with Gamaleya Institute. However, the IATF has yet to respond. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Most of the donated 400,000 doses of Sinovac vaccines will be allocated to areas with severe COVID-19 cases. These include the National Capital Region and other provinces. Rosalie Cos will tell us why.
Amid the alarming COVID surge in the country, the government will intensify its COVID-19 inoculation in virus epicenters of the Philippines. The palace revealed that the Interim National Immunization Technical Advisory Group or NITAG decided to allocate the donated 400,000 doses of Sinovac vaccines to COVID hotspots, particularly in Metro Manila, Laguna, Cavite, Rizal, Bulacan, Cebu City, and Davao City.
Nagkaroon na po ng desisyon ng ating NITAG na yung mga kakarating lang po na pinakahuling donasyon ng China na 400,000 Sinovac ay ibibigay ang karamihan nito doon sa mga pinaka-apektado ng new variants. Kasama na po ang NCR Plus at ang Cebu at Davao.
The palace official ensured that speedy distribution of the shots for the vaccination of healthcare workers. Meanwhile, the procured 1 million doses of the Sinovac vaccines are also intended for medical frontliners.
So hanggang hindi pa natatapos yung 1.7 million, sila pa rin po ang priority. Pero antayin po natin ang sasabihin ng NITAG kasi baka naman po pag dumating na yung 1 million na binili natin, may plano po talaga na isabay na yung mga economic frontliners na po pwedeng kumuha ng Sinovac. Pero sa ngayon po, talagang health workers pa rin po. Nang sa gayon, lahat po ng health workers ay magkaroon ng opsyon na magkaroon na ng bakuna ng Sinovac.
The 1 million doses of Sinovac vaccines will arrive on March 29 and President Rodrigo Duterte will witness it to signify the arrival of the first batch of COVID-19 vaccines purchased by the government. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the occupancy rate of intensive care units for COVID-19 patients across the country is already near a moderate risk. Aiko Miguel will tell us why.
53% of the recorded COVID-19 cases in the country are from the National Capital Region, followed by Cavite, Laguna, and Bulacan. According to Treatment Czar Undersecretary Leopoldo Vega, the healthcare utilization rate is still at low risk or 41%. This is the occupancy rate of ICU, isolation, and ward beds in hospitals for COVID-19 patients. But it also appears that the ICU utilization rate in the National Capital Region is almost nearing 60 to 70% occupancy rate.
Yung ICU utilization across the country tumaas na, nearing the threshold of moderate risk.
The occupancy rate for COVID-19 isolation and wards in NCR is at moderate risk or about 70 to 85%.
Napapansin po namin lalong-lalo na dito sa areas ng Makati, Quezon City, Taguig, at Manila, ito yung matataas talaga ang admissions for COVID wards and beds, lalong-lalo na sa intensive care unit po na tumataas na sa high critical risk itong mga areas na to.
The temporary treatment and monitoring facilities, meanwhile, is at 78%. This is why the One Hospital Command has requested from the Department of Public Works and Highways to build additional 350 to 380 beds in modular hospitals in Metro Manila to accommodate more COVID-19 patients. Undersecretary Vega also reports they have hired about 2,000 healthcare workers since January to augment and be deployed in hospitals with critical level and are in full capacity. Meanwhile, Undersecretary Vega assured there will be fresh stocks of medicines for the treatment of COVID-19 patients. The DOH have coordinated with a distributor of tocilizumab and supplier of remdesivir.
They mentioned in a letter formally that the stocks will be arriving March, this March. So it's coming. I think they were just losing some supplies, but the new stocks are coming by March. So we can definitely access that.
Undersecretary Vega also clarifies that remdesivir is still a part of WHO's recommended treatment for COVID-19 patients. Remdesivir is a drug made for Ebola virus. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Aside from overcapacity problem, the National Kidney and Transplant Institute, or NKTI, is also facing challenges to hire more doctors and nurses. Ray Pelayo will tell us why.
The number of health workers in the National Kidney and Transplant Institute that are infected with COVID-19 continues to rise. NKTI Executive Director Rose Marie Rosette Liquete said some of their personnel are confined due to the severity of their condition.
Sa 98 na nag-positive sa ngayon, mga 15 ang admitted. No, I would say nandun sila sa moderate to critical. At meron na kaming health worker, 2 na namatay.
The hospital is also having hard time in recruiting doctors and nurses.
May pumupunta sa atin para siyempre i-interviewin muna, di ba? Pagka nalalaman naman nila na uma-assign kami sa COVID, uma-atras.
The 106 designated rooms for COVID-19 patients in NKTI are now fully occupied. Dr. Liquete said the hospital cannot expand the bed capacity for COVID patients as they also need to serve other non-COVID patients.
Aside from full siya, meron pang naghihintay sa ibaba sa aming emergency room. Right now, ang naghihintay sa emergency room, 51. That is a running thing, no? Baka ngayon, marami na namang dumagsa sa amin. So, wala kaming mapaglalagyan.
The public is also advised to coordinate first with their doctors before going to the hospital. Patients and relatives need to undergo swab test and x-ray.
Kaya nga kung pwede, walang pantay. Na-experience na namin na may mga positive na akala mo non-COVID, asymptomatic. O kaya pantay nila nagiging positive.
The NKTI also appealed to the public to postpone their medical checkup. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
President Rodrigo Duterte has signed the Corporate Recovery and Tax Incentives for Enterprises, or the CREATE Act, into law, with some items vetoed. This was confirmed by presidential spokesperson Harry Roque. The measure aims to reform corporate income taxes and incentives in the country, particularly reducing the current corporate income tax from 30% to 20% for micro, small, and medium enterprises and 25% for other corporate taxpayers. However, the palace has yet to release the summary of the vetoed items. The management of the Manila Port Terminal decided to allow stranded passengers to temporarily seek shelter inside the terminal as the area will undergo lockdown tonight. JP Nunez reports.
The Manila Northport Harbor Gate was full of stranded passengers yesterday, but now the gate is empty. This after the port management decided to allow stranded passengers to temporarily stay inside the port while they wait for the restrictions to ease. Also, the Barangay Council, which covers the pier, will start imposing a lockdown tonight.
Kung talagang maabutan sila ng barangay, maabutan sila sa lockdown, wala kaming magagawa kundi advise sila na wag silang gumala dyan kayo sa vicinity ng port. Bawal kayong mag-ikot-ikot, bawal kayong tumagtawid-tawid kung saan. Stay where you are. Mayaman naman ang PPA, kaya niya i-cater yun. Kaya i-cater ng Philippine Port Authority yung mga pasahero doon na may stranded sa kanila.
The Philippine Ports Authority reminds the passengers again to complete their requirements before going to the port. This is to avoid passengers cramming in the terminal.
Kung kayo naman po ay pauwi sa inyong mga place of residence sa inyong mga probinsya, kayo po ay papayagan na makasakay. Pero check-in nyo din po kung ano yung requirement ng inyong probinsya o ng inyong destinasyon, kung kayo po ba ay i-require na magpresenta po ng negative result na RT-PCR swab test po. Dahil kung kayo po ay walang negative RT-PCR swab result, hindi din po kayo pasasakayin sa barko.
JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, Amid the worst U.S.-Chinese relations in decades, U.S. President Joe Biden compared Chinese President Xi Jinping to Russian President Vladimir Putin, calling them both supporters of autocracy. Mariela Toza explains why.
On his first solo news conference on Thursday, U.S. President Joe Biden have vowed to push China to play by international rules, criticized his Republican opponents, and defended his policy to provide shelter to children crossing the U.S. border from Mexico. Amid decades of tensions between the U.S. and China, President Joe Biden compared Chinese President Xi Jinping to Russian President Vladimir Putin, calling them both supporters of autocracy. However, he emphasized that the United States was not looking for any confrontation with China over differences on trade, Beijing's rollback of democracy in Hong Kong, military buildup, and the treatment of minority Uyghurs, and added that he has a good relationship with his Chinese counterpart.
He's one of the guys like Putin who thinks that autocracy is the way of the future. Democracy can't function in an ever complex world. Doesn't have a democratic with a small d bone in his body, but he's a smart guy.
Biden said he made it clear to Xi that the U.S. will invest in its economy and democracy at home, and insisted the Chinese leader to play by international rules, fair competition, fair practices, and fair trade.
That this is a battle between the utility of democracies in the 21st century and autocracies. We got to prove democracy works.
Meanwhile, Biden added that no previous administration had refused care and shelter to the children coming over from Mexico except that of Trump. He noted that Vice President Kamala Harris has been selected to stem the flow of migrants. Furthermore, the Democratic president has set a new goal of administering 200 million vaccination shots against COVID-19 in the United States in his first 100 days in his office. The 78-year-old U.S. president said he plans to run for the next presidential election. Mariela Toza, UNTV News and Rescue. We serve the people, we give glory to God.
Secret recordings reveal how a global white supremacist terror group actively targeted young Australian men for recruitment. Marvy Delphin give us the details in this report.
Militant American white supremacist terror group The Base has been running a recruitment drive in Australia as part of its efforts in preparing a race war to establish a white ethno-state. Hundreds of covertly recorded conversations of potential Australian recruits being interviewed by senior members of the base in late 2019 and early 2020 through an encrypted messaging app called Wire have been leaked. The unnerving details of the recruitment process were captured in the audio files, which involved several email exchanges and questionnaires about ethnicity, physical fitness, ideological pathways, and whether they read Adolf Hitler's Mein Kampf. Russia-based founder Rinaldo Nazzaro aimed to increase the organization's presence in the country by actively reaching out to Australian men, particularly teenagers, who had access to firearms, security licenses, and combat training. Among the would-be Australian members was a 16-year-old high school student from Canberra, and at least 3 applicants who expressed support for the New Zealand mosque massacres. The Australian Security Intelligence Organisation has recommended a number of extreme right-wing groups, such as The Base, be declared terrorist organizations in the country, so people can be outlawed from becoming members and supporting its operations. But the domestic agency has not succeeded, as Australia's legal definition is narrower than in some other countries. Marvy Delphin, UNTV News and Rescue, Australia. We serve the people, we give glory to God.
After leading the global vaccination drive, Israel displays another achievement after successfully vaccinating more than half of its population. Early Briones reports more.
Israel once again hits a global milestone, proving their edge in the battle against COVID-19 as they finish vaccinating more than half of its population. Israel's Health Minister Yuli Edelstein reported that 50.07% of the population have now received the two-dose Pfizer and BioNTech vaccination, and an overall 55.96% have received the first shot. The vaccine was rolled out December of last year to individuals 16 years and above, and ever since then, infection and death rates have plunged, according to Israel's Weizmann Institute of Science. Figures show that daily death toll in the country have dropped down by 85%, and daily infection rates 86% less. Critically ill patients have since also decreased by 72%. Those who have been vaccinated are said to be fully protected 1 week after receiving the second shot of the Pfizer vaccine. Fully vaccinated individuals, together with those who have fully recovered from COVID-19, are given a green pass, which gives them access to certain facilities now that restrictions are easing up. The health minister, however, warns the people not to ease up on safety precautions. Otherwise, coronavirus will keep returning despite completing vaccinations. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
In other news, a man from Georgia, USA was given $915 worth of coins by his employer as his final paycheck after leaving his job in November last year. May Viandog will tell us why.
Andreas Flatten was shocked to see a pile of 90,000 pennies covered with an oily substance at the end of his driveway as he was leaving his house with his girlfriend earlier this month. Flatten said he had difficulty getting his final paycheck after leaving his job at Peachtree City's A.O.K. Walker Auto Works in November, to the extent of asking help from the Georgia Department of Labor. It is now part of Flatten's nightly routine to clean the pennies to obtain cash, saying that it took him around an hour and a half to clean up several hundred, and that it is not fair as it will be a lot of work for money that he's already worked for. Meanwhile, the owner of the shop, Miles Walker, claims that he doesn't remember whether he did or did not drop the pennies at Flatten's house, and that it doesn't matter as he got paid anyway. On the other hand, Flatten's girlfriend Olivia Oxley said that she hopes her boyfriend's story will show how poorly people can be treated by their employers. Oxley and Flatten are looking at the employer's childish act in a positive light, and further stated that they are bound to find a few treasures with that many pennies, refusing to let Walker ruin a single moment of the couple. Mavian Doug, UNTV News and Rescue. We serve the people, we give glory to God.
Our Kasangbahay, as the world faces these trying times amid the pandemic caused by coronavirus, we are inviting everyone to join the global prayer for humanity from Monday to Friday, 9:30 p.m. Philippine time through these social media accounts.
And those are the reasons behind the news, March 26, 2021. I am Marlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.